Hi YouTube, so this is Candace with Counseling Minus the Ball. So today we're going to do a video about borderline personality disorder. I know it's been a while guys, but I want to get this video out and today for just awareness for if you're in this journey of healing, growth, and loving as well. And thanks for watching the video. Please like, share, and subscribe. So let's jump right into it. So I actually have notes and I have my DSM 5 diagnostic statistical manual mental health disorders. So anyway, so borderline personality is a pervasive pattern of instability of interpersonal relationships, self-image, and effects, and marked impulsivity beginning by early adulthood and present in variety of contexts, and is indicated by 5 of the following: frantic efforts to avoid real or imagined embarrassment, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and de-evaluation, identity disturbance, marked and potentially unstable self-image or sense of self. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. Example, spending, sexual behavior, substance abuse, reckless driving, binge eating, gambling, so on. Number 5, reoccurrent suicidal behavior, gestures or threats, or self-injury behaviors. 6, affective instability due to a marked reactivity of mood. And examples are intense episodic dysphoria, irritability, anxiety usually lasts in a few hours, and only rarely more than a few days. Chronic feelings of emptiness, inappropriate, intense anger, difficulty controlling your anger. So you have frequent days of tempers, you have constant anger, you have reoccurring physical fights, transit, stress-related, paranoid ideation, or severe dissociative symptoms. So that's DSM. You must have 5 of what I've listed. It was actually 9. Must have 5 contexts out of the 9. So actually some stuff I wrote down that's kind of more understandable, plain language. So basically it impacts the way you think and how about you think and feel about others and yourself. So you're looking at some self-image issues. You're looking at difficulty managing your emotions and your behavior. So that comes in with the losing your temper, being irritable. You have a pattern of unstable relationships. It can be intimate. It can be with friends and family, because also based on my notes, it says that you can go through these go through the anger, impulsiveness, mood swings of extreme happiness, irritability, shame, anxiety, and then also go through these periods where, hold on, I'm trying to find it where I wrote it. Guys, I cannot read my own handwriting. But anyway, you have periods where relating to your relationships, you have periods of having this anger, this frustration, this irritability, this temper, this sarcasm, these physical fights, even with people that you care about. And it can be for periods of hours to days. Also coming with that is intense fear of abandonment or instability. You have difficulty being alone. like I said, inappropriate anger, impulsiveness, frequent mood swings, from extreme happiness to anxiety, irritability, physical fights. It usually begins in early adulthood, but it gets better with age with treatment. Some other things we didn't talk about as symptoms is period of stress-related paranoia and loss of contacts with family. That's what I was trying to get to, and it can be for minutes or it can be for hours. We talked about the impulsive behavior. We talked about suicidal threats of behavior, self-injury, in response to fear, separation, or rejection. Ongoing feelings of emptiness. We talked about that. So some of the things that you can do with borderline personality disorder. Some of the treatments is CBT. Like I said, I'm big on CBT. CBT can be effective for a lot of mental health disorders. So with CBT, you're going to do talk therapy, which focusing on modifying your negative thoughts and behaviors and emotional responses. And then if you do notice that you're having some loss of temperature, loss of temperature, Lord, I used to work in the hospital. Loss of your temper and your irritability, anger management may be beneficial. So we did a video early on about anger and hostility laws and recognizing your triggers, writing down how you could have, or identifying how you could have handled the situation. We talked about deep breathing. We talked about using objects to calm down, so you can get like a stress ball, or you can get these the aggressive toys, or like a punch bag is not a toy, but you can get like a punching bag or something to help you release your anger. So anger management, psychotherapy is another form of treatment. Dialectical behavior therapy, which is talk therapy, and it encourages people to accept yourself and also to change your negative behaviors. Now, I need to go look into some of that because I actually like that focus explanation of it. Another one is schema therapy, which is psychological treatment that helps people change negative lifelong behavior patterns, which is called schemas. And then lastly is transferred focus psychotherapy, which is used for mood disorders basically. So it's used for unstable moods, behaviors, relationships. So basically we went through that really fast about defining it. We went through some of the treatments. I know I mentioned in the other video that what was it? I think it was the video for what did I say? The bipolar personality disorder. So we talked about in that video about seeing people as all good and all bad, and actually this is for this disorder. So excuse me, like I said, I'm a student, I'm still learning, and this video is a part of me learning, and it's a part of me developing skills and identifying diagnosis and learning treatment. So okay, apology there, but anyway, so borderline personality disorder is the all good and all bad. So this refers to the unstable relationships that they have with people, family, friends. So you either are all good, and then like I said, it's basically it kind of says this when it's describing pattern of unstable relationships, and an example is like one moment I idealizing a person, and the next moment you're like reevaluating the person. You're believing the person don't care about you or it's going to leave you. So it's either you're all good, you're all bad, and then the relationship is tarnished once you're all bad. It goes as far as even for jobs as well. So some of the signs that you can look for, it's I would say job hopping. With everybody who job hops is not suffering from borderline personality disorder. Some people just like growth. Some people just don't like the job. Some people just want to go in a different field. So, but yeah, so one of those signs is inconsistent job history. It can be inconsistent relationships. It can be the impulsiveness. It can be accompanied by substance abuse. It can be also accompanied by other mental health disorders such as anxiety, such as depression. What else did I see? Risky behaviors, reckless driving, sexual behaviors, unsafe, not protecting yourself, doing these activities. So yeah, it can be associated with lots of things and different signs to kind of guide you to this diagnosis. Like I said, as far as prognosis, meaning the outcome with treatment, it's stated to be better with age and better with treatment. So, like all of us, when we're maturing, when we're children, we act as children. But when we're getting older, we're maturing. Think of it like that. It's like the life cycle. You're maturing. You're getting better with age. You're getting wisdom, and just like with treatment, you're getting better, and you're working on these negative thoughts and behaviors, and learning how to handle these situations. So in the future, you can handle it differently. You won't be so irritable or have these temper moments, and just really learning how to control your thoughts and your behaviors, because like I said, your mind is a powerful thing. So yeah, I hope this is helpful. I hope this has helped someone, and also I hope it was good for you to just be aware. Sometimes just people observing, you can see a lot of things. So being able to identify it for yourself is awesome as well. Especially during this time, it's still COVID going on. A lot of people are going through so much right now. So you can imagine what is really going on with everyone's mental health. So thanks for watching. Like I said, please like, share, subscribe. Next video, I'll try to make it sooner. I definitely have to get better at this. Thank you guys for being patient. This love and growth and healing journey. I'll see you next time.